management, and it's certainly something that we don't always get the privilege to ask about, or the time to ask about in the clinic. And so it's been a really educational opportunity for me as well. So hopefully I can provide some education today, but I also learn a lot from our teens and our parents. So I'm going to share my screen and we'll start the talk. So let me see if I can go. Let's see. Can everyone see the first slide?
Yep,
It's
it looks
very, very bright. So
fantastic.
great. Okay. So basically, my goal through this presentation is to dispel some of the myths about the role of lifestyle or headache hygiene, and hopefully open the door for more discussion and openness to the ways we can use lifestyle to our advantage in this fight for greater pain relief and greater function through the pain. So with that, I'm going to start with talking about the timeline. So we'll address the what. What in the world does my doctor mean by lifestyle changes or headache hygiene? Why would lifestyle changes make a difference in my headaches? It's not like it's my fault I have headaches. And then how am I supposed to make these lifestyle changes anyway? And how do I know if I'm even doing it right? The when is for our teenagers, most importantly, and that's really when can they start to take more ownership of their health and medical plan. And part of how we make the most of our headache plan is not just in our lifestyle, but also in our increased independence in managing our care. So hopefully all of these things will be helpful things to touch on today. So let's start with the what. What does my doctor mean by lifestyle changes or headache hygiene? And these are basically things we can do in our daily lives that make it much harder for headaches to come. So I will start, I think, with just a true or false question. And feel free to answer this silently to yourselves, but true or false, when my doctor asks me about my lifestyle, he or she assumes that it's my fault I have headaches, or it's my fault I have not responded to our treatment plan. So the answer is, or at least it should be, false. This couldn't be farther from the truth. And as doctors, I feel like we do need to do a better job discussing why we talk about lifestyle and the role we each have to play in your healthcare plan. This is one of the myths I hope to dispel in this talk. Certainly there are things that we'll touch on in modifiable risk factor discussions, but there are non-modifiable risk factors that are things we cannot control. These are things like genetics. So a lot of our families and patients have a family history of migraines, for example. Biological sex. Certainly boys get headaches, but girls tend to get them more often. Hormones and age kind of overlap a little bit, but sometimes puberty, starting your period, menopause for some women, those hormonal shifts can affect their risk factors or the frequency or presence of migraines, frankly. But then there are also multiple modifiable risk factors, and those are things that we can control. And there's at least 7, if not more, but I'll touch on the 7 today. So what are they? So exercise, water, nutrition, sleep, smart electronic use, stress management, and relaxation. So I'll start with the exercise piece and then that exertional role of exercise, and then we'll end on a relaxing note. And I'm going to break them all down into each of these 7 categories with the why and the how. It's important to note, though, that talking about these things does not mean that you're failing and therefore this is the cause of your headaches. These things help build our armor against our headaches. And I kind of like to illustrate this in an analogy that I have found somewhat helpful for patients. So think of your risk factors or your predisposition to headaches as a campfire, like the picture at the top. For whatever reason, whether through genetics, hormones, your body is predisposed to migraine, for example. There's not much that we can do about it. Now, if we could, we'd put that campfire out. But for the purpose of this example, you're at risk for it. We know you have it. We can't put that fire out. So how do we prevent this campfire from turning into a full blaze forest fire? And there are things that we can add or surround ourselves with, such as sandbags and other fire mitigation tools that can keep that fire contained. And then we might remove fire hazards like, combustible materials, lighter fluid, those things that can really ramp up that fire. And so this is the role of those lifestyle modifications. For better headache protection, we really need to both add in things that can help our headaches and then remove or manage the things that can add fuel to our headaches. So I know what you're thinking. You might be thinking, now wait a minute, you're telling me that medicines aren't going to help me? So there's certainly a role for medications and other interventions that we as doctors provide. These are just one of the tools, though, that we add around that campfire that can help. But it's only a small piece of the puzzle. We as physicians have a really important role. We want to know what type of headache you have because the way we approach treatment can differ. We also make sure to rule out the big and scary. So that examination, talking with you and your history, we make sure that we're not missing something. We also can pinpoint areas that could be adding or contributing to your headaches, like that might need special intervention, like physical therapy, vestibular therapy, counseling, relaxation training, all of these things. And yes, medications, supplements, devices that we use can help support your treatment plan and help you get back to functioning and improving in pain. But we only provide a part of that puzzle. The bulk of getting better is really hard work and takes time and falls a lot on you as an individual. And we're part of your team to help you get to having a good response for your treatment plan. All medicines are a short-term solution in that we don't expect all of our patients to be on the medicines we give forever. So if we don't do the hard work, even with the medications, you're not going to get as really better in the long run. All right, so let's start with exercise. So a little bit of statistics. What exactly is the role of exercise on headaches? So studies have shown that obesity or having a BMI over 30 increases your risk of migraine type headaches by 50%. And that is similar to what we see in heart disease. A lack of exercise increases our risk of migraine attack by 21% in adults and 50% in our teenagers. On the flip side, both physical exercise and relaxation exercises can be equally effective as a prescription when you're doing it like 40 minutes, 3 times a week. And there's a lot of different websites and resources that kind of talk about the effects of exercise on headache as well. So knowing why exercise can be important, how should we exercise to help our headaches? And there are 3 things exercise should include. So aerobics, this is something that gets your heart rate up, a brisk walk, jogging or running, riding a bike, swimming, rowing, skiing, jump rope. You can work up intensity over time based on goals you set for yourself. Moderate versus high intensity is usually what people describe. And that just means, if you can talk, it's moderate. If you have to pause and catch your breath, it's high intensity. Muscular strength is another component. Weightlifting would be a category like that, whether it's barbells, dumbbells, weight equipment. And then endurance, which is a fancy word called calisthenics, and that's conditioning, like weight training as well, but like running and swimming, just building up that endurance aspect. Flexibility is also the third component. Stretching as part of your workout or separate activity in and of itself, like Pilates or yoga. And a lot of people wonder, how in the world am I supposed to fit exercise in my already hectic life? So some tips could be, pick something fun. Exercise isn't fun for any of us if we don't enjoy it. So what do you like doing? It could be dancing, hiking, join up with a friend, and make it convenient. If you like to get it out of the way, try doing it in the morning. If you're one who likes to do it after school or work, then do it then. You can find a gym that has flexible hours, or pick something that doesn't require expensive equipment if that's a hindrance. So jump ropes, weighted vests, those are some great alternatives to gym equipment. And then even like home DVDs. So there's a lot of ways to get really creative about it. So let's talk a little bit about water. So most of you have probably heard someone say that we're 70% water. So it's no surprise to hear that water plays a critical role in how our body functions. In reality, it's actually somewhere between 75% in infants to like 55% in the elderly. But for our brain and our other organs to work well, we really need a healthy balance of water and electrolytes. We lose water and electrolytes in several ways during the day. We pee, we sweat, we have saliva. If you're sick, you may vomit, you may have diarrhea. And we replace those electrolytes with fluid as well as foods we eat. At least a third of migraine patients are triggered by dehydration. Even very mild dehydration actually can initiate a headache. Things that might suggest you're dehydrated, you might be dizzy, confused, muscle cramps, or dry lips or mouth, irritability, but we often kind of use like urine color. So if it's like darker than sand, then that could be a sign that you might need a little bit more water. One study actually even found that increasing fluid intake caused a significant improvement in function, and about 50% of patients who did that felt at least a 6-point reduction in their pain scores. The image on the right is a helpful illustration of all the things that water does for your body. And it's easy to see how insufficient intake can make a huge negative impact on our body overall. And remember, like our brain has one of the highest metabolic demands of our whole body. And so we've got to have it work well for the rest of our body to do what it needs to do for us. So how do you change your water intake to help your headaches? As a goal, you want to drink at least 8 8-ounce cups or 64 ounces a day. And this is on top of anything you drink for vigorous exercise or sports practices. Some of us need actually about 90 to 120 ounces. So if a doctor's told you you've had POTS or dysautonomia or something like that, then you need to be on the higher end for your body. In general, try to avoid sugary, salty sport drinks, as those can contribute to dehydration. Good old regular water is totally fine. That being said, if you're having like severe dehydration, like if you're sick and you have vomiting and diarrhea, things like Pedialyte, Smart Water, things like that are totally great, and you actually might need those. But some find drinking electrolyte containing fluids also during a migraine can be helpful. Also remember that caffeinated beverages are diuretics, like they make you pee. So you have to kind of subtract that from that volume. Ways to fit it in, tips: carry a water bottle with you where you go. You can motivate yourself. You can get one with those marks on it to reach your goal. I have one that's like a gallon. It's actually way too big for me to bring around to work. But I like it during the summertime when I'm like going around doing stuff locally. Also spread it out. So a lot of people say like, oh my word, my doctor's telling me to drink water and I'm gonna have to pee all day at school. So if you spread it out and try not to chug it at intervals of the day, that can help decrease the number of trips to the bathroom. And then get creative. If you just cannot stomach the taste of regular water, you can infuse it with fruit, cucumbers, all kinds of different things that you could do. All right, so let's jump to nutrition. So it's been well established in the literature that fasting or kind of lower sugar levels can trigger or worsen migraine attacks. Even small fluctuations in your blood glucose can rev up a headache. And a fairly recent study showed that missing a meal or fasting can precipitate headaches in about 57% of patients, which is similar to what we see with hormone fluctuations in women. Also similar to the rates we see with sleep challenges and stress. And an 8 to 12-hour fast at night may not cause like hypoglycemia that you would see on labs, but it's postulated that poor glucose regulation, just the way that our body manages glucose in our body, can be a precipitating factor to having more headaches. So along the same lines of nutrition, caffeine intake is associated with headache risk. And if you drink more than like 8 ounces of coffee a day, unfortunately for our headache patients, some people can get away with it, but most headache patients, we have to kind of limit that a little bit. It's not totally fair, but it's just something that we tend to see. So ways that we can improve that, try and avoid skipping meals. You can consider eating 5 small meals daily. Try and eat something with protein or healthy fat within an hour of waking up in the morning, even if it's small, like a protein bar or a handful of nuts. Obviously avoid food triggers that you're aware of, and then try and balance your plate. Name of the game is usually whole grains and healthy fats, lean proteins, and lower salt. Obviously, those of you who know you have POTS or dysautonomia or something where you have higher amounts, then you know that the salt part doesn't apply to you. And then supplements can help, such as magnesium, riboflavin, coenzyme Q10, and you might hear about some of those from your headache doctor. Some tips on including more nutrition into your diet would be, consider eating 5 small meals a day and balance that plate. Try and do a third protein, a third veggies, and maybe a third of a starchy vegetable or whole grain. And then just try and avoid processed food if you can. And if you want a more detailed list of good foods from these 3 categories, I can include that at the end. That was put together by a couple of our providers in our department, and we provide that to a lot of our patients as well. So we can give you access to that list. And then if you have access to a dietitian through your insurance plan, use them if they're a free resource available to you, use them because they can have a lot of useful tips as well. All right, let's keep it rolling. Let's talk about sleep. So there are strong links between headache and other sleep disorders, and insomnia affects most migraine patients. People who generally wake up with headaches or whose headaches occur in the morning or headaches that occur every single day for months, like our chronic headache or migraine patients, often have another type of sleep disorder, whether it's, like I said, insomnia, or some have restless leg syndrome, periodic limb movements, things like that. And then we know that sleep deprivation, poor sleep quality, and fatigue impact how often we have headaches and the disability that we have from those headaches. And there's a lot of science that goes into that, and there's like overlap between our anatomy and the physiology, like what's going on a cellular level, that actually overlaps with headaches and sleep disorders. And so we try, as I mentioned before, look for indications of that when we see you in clinic. We might check some labs like a ferritin level or things like that. And we try and work on the sleep aspect as well, because we know that will help you. Pediatric patients who have poor quality sleep for 10 or more years have actually been shown to be at much higher risk to develop episodic or chronic headaches well into adulthood. And so it's one of those things that we really try to get a good handle on if we can while you're younger. Hold on. Skipped one, so let me back up there. All right. So similar trend. How do we incorporate this? So addressing underlying sleep disorders is critical. So as I said, that might involve specialized tests, visits with a sleep clinic. Workup may include screening also for mental health and mood disorders like anxiety and depression. And this is not necessarily because we think you automatically have a mental health problem. It's just because not only does headache commonly coexist with sleep disorders, but sleep disorders and headache commonly coexist with mental health disorders such as anxiety and depression. And so addressing any underlying issues there is a vital step in helping with sleep and headache. There's strong evidence stating that at least these three areas must be addressed simultaneously to get the best results. And frankly, there's honestly going to be a chicken and the egg question. So 50% of all migraine attacks occur between 4 and 9 a.m. And that poses more risk or likelihood to get a sleep disorder. And that stinks. And then we know that poor sleep begets worse headaches. Worse headaches begets poor sleep. Poor sleep and headache begets irritability, fatigue, heightened anxiety, and depression. So we know that there's like a vicious cycle there. And that's why we kind of address all three together, because they all feed into one another. The goal is to get a minimum of 7 to 8 hours of sleep at night. Most teenagers and adults, frankly, need to aim for 9 or 10. And then try to avoid naps if so you can more easily get to sleep at night. And then the other piece of that for tips is know that quality sleep does not necessarily mean is not necessarily equal to more sleep. Napping during the day can increase your fatigue during the day and worsen insomnia and decrease the quality of sleep at bedtime. So even excessive sleeping can be bad. And then maintain a regular bedtime and wake time. Try not to deviate more than 90 minutes off of your sleep schedule, and use your bed only for sleep so your brain can be trained to associate bed with sleep. And then you can try and unwind 20 to 30 minutes before bed with something off screen. So you can stretch, read an actual book, listen to music, even have like a cup of tea or milk, a light snack, and then have a routine at bedtime, whether it's like brushing your teeth or showering or taking a bath. And then try and keep devices out of your room if you can, or at least out of reach. And then resources available to you. Cognitive behavioral therapy is proven effective in helping with pain management, strengthening that rest and digest nervous system, which helps with sleep and relaxation. And so it's usually actually a first-line treatment for sleep in adults with insomnia. So plain and simple, it works. And along those same lines, sleep psychologists are really helpful at coming up with tips. So use them if you can. So smart electronic use, we used to say, I don't even know if that was that long ago, that we actually needed to cut down on electronic use. And obviously that is not at all realistic in our current day and age. We all live and function on electronic devices. Some of us with 4 or more devices that we use throughout the day, myself included. So we really just have to get smarter about how we use electronics in our digital age. Numerous studies have demonstrated adverse effects of frequent television use and headaches, particularly migraine. And overall, I think the association of headache and electronics is complicated. It may involve the brightness of the screen with light sensitivity, decreased exercise if we're not, up and about as much, bad posture contributing to our neck strain, and timing of the electronics and melatonin effects on sleep. So if you, towards bedtime, you're on the screen or on TV, that can make it harder to fall asleep. And then there's eye strain and dizziness and contrasting light and noise, like in the movie theater, for example, and a ton of other examples. And one study showed that 46% of migraines in kids were influenced by computer use, followed by loud noise by 42%. And those who use smartphones actually have a greater risk of needing acute medications and less relief from using those acute medications. And then another study showed that up to 90% of university students had something called computer vision syndrome. It's also known as digital eye strain. And especially if the computer was used for more than 2 hours continuously during a day. According to the American Optometric Association, CVS, or the computer vision syndrome, is a group of eye and vision related problems that results from tablets, e-readers, cell phones, prolonged computer use. And symptoms of that include headaches, eye strain, blurry vision, dry eyes, neck and shoulder pain. And it's also associated with the environment we are in during use. So poor lighting, glare on the digital screen, poor posture, improper distance on viewing, uncorrected visual problems, like if you're supposed to wear glasses, or any combination of those things. So ways to approach electronics more wisely would be take breaks. 2, be smart with light input. For some people with migraine, any light can be a problem, even natural light, making it hard for people to spend time outdoors and inside. So helpful ways to get around that include sunglasses. Some are better than others. Try and sit closer to windows when indoors, so you can maybe avoid flickering light sources and glare. Get that annual eye exam that we always tell our patients to do to make sure that your glasses are up to date or whatnot. And then it may be as simple as eye drops if you get dry eyes. And then finally, avoid electronics 30 to 60 minutes before bedtime and during the night. Some tips, you can try using a green light. Those can actually help with migraine, or sunglasses that deflect all light bands but green. An alley lamp is one thing you may have heard about. It's a lamp that you can try based on that particular frequency of light. And then there's been some evidence that blue light glasses can help, but there's honestly not a ton of literature on it. So some of our patients love it and some don't. But I will say that the cheap ones can be just as effective as the pricey ones. So try the cheaper ones first before you spend a ton of money. And then the other thing I wanted to mention is this 20-20-20 rule. I actually learned about this from one of our providers, Dr. Gerson, who said that that's been effective for a lot of his patients. And it was established by an optometrist in California, Jeffrey Anshell, for those of you who like that kind of information, to help remind people to take breaks and prevent eye strain. And the principle is to take 20-second breaks from the screen every 20 minutes by looking at something 20 feet away. And that helps relax your eye muscles. And this is particularly helpful if you have dizziness with your headaches, or if your doctor has noted some vestibular dysfunction, like your balance center is off, or if like converging on things moving closer to you has been hard. And you can focus on something outside the window if 20 feet inside is challenging, like you can look at a tree outside. Another thing you can do is just close your eyes for 20 seconds every 20 minutes. This can also help if you have dry eyes. You can change your computer settings, night mode on devices, make text larger to reduce eye strain. Anti-glare screens can help. And then consider ways to improve posture when working. So you can stand with a heightened desk, take breaks, get up, walk around, work on good posture when sitting, like using an ergonomic chair or an exercise ball. And then you can do some neck stretching breaks like this person's trying to do in that picture. And then apps can also help. There's a few called Protect Your Vision or Eye Care. Like there's tons of stuff out there. Any questions so far? Am I losing anybody, boring anyone just to death? I'll try and finish because I don't want to take up the whole time, because I really want to give time for discussion. So stress. Stress is the #1 trigger for migraine patients. 50 to 70% note a strong association between daily stress level and daily migraine activity. And one study noted a high association between stress and progression to chronic headaches, with 36% reporting stress as a trigger, and then 45% felt that a stressful event correlated with them going right into a chronic headache pattern, which is one that's like 15 at least days a month. And then 45% who already had chronic headache reported worsened headache after a stressful event. So like the chicken and the egg phenomenon we talked about with sleep and other hygiene categories, migraine can cause stress, which worsens migraine, and the cycle goes on and on. And to complicate it further, if your body is used to constant levels of stress, some people notice that they get what's called a letdown migraine over the weekend when stress suddenly drops. So you may find that you get a sudden headache flare when, Saturday hits or sleeping in, and then it tends to come out. And if you wanted to know more about what has been defined as stress in the literature, I can dissect that a bit for those of you who are interested. But like I said, there's so many directions you can kind of take this category because it affects all of us. So stress management, Obviously, in order to get better, we need to completely eliminate stress from our lives, right? Well, no. Obviously, eliminating stress is not at all realistic. Stress is a natural part of life. It is helpful to be able to perform on tests, get work done, you name it. However, there are ways that we can reduce external and internal stressors and build up that rest and digest nervous system. It's like a muscle, that system that's also called our parasympathetic nervous system, that helps protect us against stressors that come in. And it may seem obvious, but it can be really challenging for all of us to recognize sometimes. So one way to reduce environmental stressors, reduce things that you know trigger and increase those things in our environment that are calming. This may involve changing up our environment. So a bench in a park, quiet, dimmer spot in the library, using the green light, calming music, earplugs, and then reducing those internal stressors. So I think we all need to have more realistic expectations of ourselves, prioritize things in a list, such as, okay, this is general life stuff, and then this is the now category. The now category is stuff that I really need to take care of first, and then I'll get to the general life stuff after. And then we need to increase our ability to unload stressful input. Maintaining balance and outlets is so key to this. So make time for those important relationships and personal growth in your support networks and things that are just really important to you. Counseling is one really important way to unload some of that stressful input, or at a minimum, someone you trust that is close to you. And the goal is to really improve our body's healthy, natural, or what we call physiologic response to stress, so that we have ingrained tools to make stress less likely to trigger a migraine attack. So some other tips you can do that we'll talk more about, like biofeedback. Physical exercise is a stress relief activity. Relaxation exercises. Those are things that kind of help offload some of that stress that builds up in all of us. One quote from a renowned headache specialist, Dr. Peter Goadsby, he said, "The migraine brain is vulnerable to change, such as sleep and stress, and is therefore best kept stable." So what he means by that is, the brain really likes things to be at an even keel. And so we really want to keep life balanced so that we're not straining ourselves too much. Learn to say no more so that we can realistically handle things at a given time. One thing that I have personally, because I know we all deal with stress, that I found really helpful in my own life, one, avoid procrastination at all costs, but sometimes what you can do is start with the hardest, longest commitment first. So if you've got a list of tasks, start with the one that you're like dreading the most. And if you get that thing over with, then you feel like you're just coasting downhill at that point. And so you can really have an easier time getting that rest of that stuff done. And then I can't emphasize enough the importance of counseling to just empty that closet or clear the cobwebs that build up in our body that need to get out. So let's end on a nice relaxing note. So relaxation helps headaches, and I kind of touched on this with the previous slides with stress, but there are a few proven methods that help headaches: biofeedback and progressive muscle relaxation. But what exactly is this? So biofeedback is short for biological feedback, and this involves often using a monitor, a heart monitor, muscle monitors that look at our heart rate, our muscle tension. It can look at our skin temperature and various other areas, while using relaxation exercises. So like we can see in real time how our body responds to our behavior. And it helps us be aware and gain more control of those unconscious and involuntary body systems. Relaxation helps us calm down our sympathetic nervous system, that fight or flight, and strengthens that rest and digest nervous system. And that allows us to deliver more oxygen to our organs, including our brain, which helps with headaches. It reduces muscle strain and tension. It improves GI symptoms because we can digest and our motility improves. It reduces the impact that a stressful event triggers. And just like those of us with exercise, those of us with the parasympathetic um, overdrive, I should say, those of us who exercise strengthen that muscle, and we exercise that parasympathetic nervous system that rest and digest. So it makes it harder for those triggers to affect us. And then, the other thing I was going to add is you may hear us talk a lot about biofeedback and whatnot in the headache world, because it really works. And it provides up to 60% reduction in headache frequency and severity. We also can combine it. And so some studies have shown that combining both biofeedback and some of our headache medications gives you a really robust improvement. Other things include like acupuncture, massage, and other things like that. So a couple other tips, and I've kind of touched on these already. But I'm going to give another quote from another anonymous clinician. They said, headache sufferers are justifiably offended when a doctor or a friend dismisses their pain with an offhand remark such as, "You're just under too much stress, try to relax." And I'm sure we've all heard that, and it's not helpful to hear a lot of the time. And they said physical and mental tension can certainly make headaches worse, but simply telling someone to relax doesn't help deal with deadlines, demanding bosses, crying babies, honking horns, unpaid bills, and missed sleep. Just to name a few of the daily hassles in life. So relaxation is a skill, and like other skills, it can be mastered with time, practice, and a good instructor. And there are a variety of mind-body approaches to easing tension and improving pain tolerance. And some have proven track records in preventing headaches, and as I mentioned, biofeedback is one of those things, as well as some of those other tools that I mentioned. Some tips, there are a lot of good apps out there. So Headspace, Calm, Aware, and I have a list of a few other ones at the end that can be really helpful. And some things like, if you're not the kind of person who can just relax, I'm one of those, like I just sit still and I just cannot shut my brain off. And so sometimes that person, like myself, need active relaxation tools. And so those are things that they have on some of the apps that you can do, where you're talked through an exercise. And that can be helpful. Schedule it. So we're more likely to do things when they're scheduled. Just 2 to 3 minutes, 3 times a day can do a lot of good. And we don't want to just bring it out when it's game time. We really want to schedule it even when things are calm. Hang on. There we go. I thought we were getting stuck there. All right. So when you're working on controlling that campfire, plus minus any medications that we prescribe, most of us should still be partnering with our doctor on our headache treatment plan. And as a teenager or young adult, if you're on here listening, how can you make the most of your treatment plan? And by being more independent and taking the reins on that plan with your provider. So when can you start doing this? Well, you guessed it, right now. Most teens really want more autonomy in their healthcare plan. So what does this increased autonomy translate to? Well, I think it serves teens and their parents best to know what it means and what it does not mean. What it means is, for our teens out there, you are the patient. We as doctors, headache doctors, are there for you. It's your health, it's your plan. You set the flow of your care. Increased autonomy typically translate to increased compliance with treatment plans. So the more you're involved with your plan, the more likely you're going to stick with the plan that we come up with together. Finally, it also allows for better and more seamless transition to when you're an adult. So what it does not mean, and this is helpful for parents, is increased autonomy does not mean there is no parental involvement. This is why it's transition and not full adult care. So parents do and should have an important role in teens' healthcare plan. And we want to support that role without adversely impacting that ever increasing role of that teen has in their care. So again, it's that gradual transition phase. So I put this little table, these little tables together to see kind of what this might look like. And we all have a role to play, doctors, parents, and teens. So doctors, we can do better. I think we should talk directly to you as the teenager in the visit, even if your parents are in the room. Let the family know the flow of the visit. So we might say at the start of the visit, hey, like you might see me focusing on your child or your teen in conversations or discussions from the start. This is not because we're ignoring you, but we want to make sure that they know that this is their plan. We also want to improve discussion expectations. So we might really emphasize like, hey, sometimes we take medicines even when we're feeling well or when we're feeling better. These preventatives are not ones that we just pull out when we think we need to. We really have to commit to those regularly. And remember why the medication is being used and when we expect to see results. Also, some teens feel physicians shy away from treatments that they wish they'd be more open to trying. And that's some of the feedback I've gotten from talking to our teenagers on this Miles for Migraine. Some feel that a doctor who is willing to work with them and try anything, quote unquote, is really a more valuable team member. So if they're um, on a medication with their psychiatrist and there may be an overlap, having a conversation with the psychiatrist and seeing if that still might work is a good option. Or if there's a medication that they can't be on for kidney reasons, if they had a kidney stone, maybe seeing if that might be something they can still take if their kidney doctor is working with them. Those are things that some of the teenagers have expressed wanting more openness to having those discussions. And sometimes we need to do a better job meeting our patients halfway. Believe it or not, many teens, and I've talked to some here through Miles for Migraine, they are not a fan of telehealth visits. And ones who are don't want them for every appointment. So we should do better asking patients more about what type of visits they need or prefer. Like, hey, do you want to see me in 3 months in person, or would you rather a telehealth visit? Parents, what can you do more? You are often your child's number one advocate. So as they transition to adulthood, encourage them to take on some of that self-advocacy as you are their number one cheerleader. So actually, I think allowing them to schedule their own appointments is helpful for them. You can give them dates and time ranges that work with your schedule, and then have them call and set up their appointments within the time frames that you know you're available. Allow them to ask questions in the visit. And then if you have a question, direct it to the teen first, or ask them if you can clarify or ask a question to the provider. Not because you're not allowed to ask a question, but to convey to the teen that this is a special visit in that transition process, and you respect the practice space to do that. On the same lines, consider allowing the teen to attend the visit either alone or take the back seat, be a fly on the wall while you're in the visit. And then by all means, be that positive reinforcement. If compliance is a challenge or being a motivation, help strategize rewards or things to help your teen improve compliance or ownership of their plan. And finally, teenagers, tell your healthcare team what you need. If you hear a plan and you have concerns or come for follow-up, tell us what does and doesn't work. If you see a new provider for a clinic visit or a procedure, tell them what is important to you up front. So you might say, I don't want to see the needles, or I like it if you count down first, or I don't like telehealth. Like, let us know, because we want to make sure that we meet those expectations. And finally, if we agree as a team to a treatment plan, commit to that treatment plan. Take your meds or work on those lifestyle changes we talk about. Set reminders on your phone. You could put checklists on the fridge, meds next to your toothbrush, whatever you need to do to remember. And of course, parents, consider when medication supervision may not be appropriate, like if you need to dispense it or if there's young kids in the house. And then also tell the teacher or nurse at school that you need your meds. Let us know if you're unable to get your stuff at school so we can get a letter or advocate for you. And then if asking at school or precautions are embarrassing, we want to know that too, and your parents, so we can adjust stuff to not impact their social environment. And finally, consider things that you can improve on and bring those up to us. So if you feel like, hey, sleep is something you need help with, let us know and we can focus on that part of your headache hygiene on your visit. So all of that to say, if you don't remember anything at all that I talked about this whole time, remember that we're on your team. And I don't mean to sound cliche, but it's true. Um, so I'd love to hear some feedback from whoever's on. If this was helpful, not helpful, what are some thoughts, concerns? Yeah, just really kind of putting it back in everyone else's court. And then, like I said, I've got some resources on here. This is from, I cannot take credit for this. This is put together by two of our providers at our clinic, Dr. Anna Esperham and Lara Coral, one of our APRNs. And then there's some apps that one of our sleep psychologists, Dr. Mark Connolly from our practice in Kansas City, gave me this list. And then I also attached an email for Kelly for a couple of literature articles on some relaxation apps. Certainly some can get outdated. You know, everything is like phasing out and in on some of these, but these are a few. So I'm going to stop blabbing and see if anyone else wants to talk.
Thanks, Dr. Brchan. That was
Yeah.
fantastic. We do have a few questions in the chat. So the first question is, you mentioned that medications are meant to be more short-term. I'm confused because I thought preventative medications such as the amitriptyline prescribed for my daughter were meant to be long-term preventative.
Got it. That is a great question. So I should clarify. So yes, preventative medications are ones that we take every day that can take 8 to 12 weeks to kick in before we may see full benefit. That being said, if we get to a goal dose on a preventative medication, and let's say kiddo's doing fantastic, we don't expect that, you know, let's say the kiddo's 14, they're responding well to the medication, they're not having any side effects. We don't expect that 14-year-old to be on that medication until they're like 25. So when we get to a good spot and good headache control and patients are doing fantastic, for example, we might say, okay, let's not rock the boat. Let's keep things stable for at least 6 months. And 6 months is kind of our made up kind of time frame. But if you're doing great for 6 months or so, then we can start talking about how you might do coming off the medicine. Because some patients don't need medications for forever and ever and ever. And we don't want to ever feel like you're obligated to take a medication forever and ever if you're doing fantastic. So basically, we feel like every patient deserves a trial off of medication if they're doing great. So I hope that clarified that question. And if not, I can talk more about that if it does not.
Okay, we'll give them a chance to respond. The second question, it says, in trying to discern if a form of exercise, my daughter likes gymnastics and diving, is helpful for migraine or making it worse, would we expect headache to appear right after the exercise, or could it appear a day or more after?
I forgot I was muted again. Okay. I was going to say that is a fantastic question. And I actually wrote something down for that because a lot of people mention like, oh my word, what if exercise gives me a headache or exacerbates my headaches? So there's a number of reasons or ways we can troubleshoot that. So one is first, try and stay hydrated. Second, eat something with protein about 1.5 hours before exercise. Third, warm up 5 minutes before any vigorous exercise. And then if you continue to get headaches with exercise, then we actually may need to explore other ideas such as switching up the preventative medication or doing another approach or workup of some kind. It just depends on how much the exercise seems to impact the headaches. But I would start with those first 3 tips. So staying really hydrated, eat something 1.5 hours before with protein, and then warm up 5 minutes before you jump in. So those are some tips for those who tend to have those headaches aggravated by exercise.
Yeah, and maybe a follow-up question. I've heard from the teens I work with that a lot of them say that exercise is a trigger, but then a few of them say, well, at least one in particular that I'm thinking of right now. He
Yeah.
tells me that, exercise used to really trigger his migraine. But he found that if he did it like slow, so like the first day he would only work out for 5 minutes and that's all he could handle. But then he'd take baby steps towards it. And he thinks that the long-term benefits of kind of pushing yourself a little bit and then stopping. He
Yes.
says he's worked his way up to like a 2-hour workout. So I'm
Yes.
interested to hear if that's actually something you recommend or if he has any,
It
if he's
is. It
correct.
absolutely is. And I will tell you that I am the same way. I feel like so many of us who, especially those of us with migraine, we tend to be very much like type A individuals or like perfectionists. Not everyone, but a lot of patients are. Um, and so some of us are like all or nothing. So when we're like, okay, I'm going to exercise, we go full on like, cardio interval training. And like, I am so bad at this. Like, I'll go from no exercise to like, CrossFit type stuff. And then my body says, oh, no way. And so definitely taking it easy and easing into exercises and working up again, like focusing on that slide where I mentioned muscle strength, but we also need to build up that endurance. And we also need to make sure that we're incorporating stretching and making sure that those muscles that are activated can have a chance to relax. And so definitely don't go full on power force. And so working that up is really key. So that's absolutely, absolutely a good way to go.
Awesome. Thanks. It's good to hear. What he figured out seems to be true. So that's cool. Let's see here. And then someone says, excellent presentation, Dr. Brchan. I especially love your stress management tips and your slide about what physicians, patients, and parents can do. So that's some good feedback for you. And I agree. I think that's awesome. That was a really, really helpful slide that is unique to this presentation that makes it a little bit more easy to understand and easy to utilize. So awesome. And then Joy said, thank you. And these answers are really helpful and great. Yeah, anyone, I know there's only 2 of you, but that's okay. Anyone have any more questions? And if not, we can close. It is on the hour at this very moment.
I know. I'll have to, next time I do this, I'll have to make it shorter so I leave more time for discussion.
And that's okay too, because these events tend to be, actually, I think your presentation was really quite well done. So like this event, we advertise 60 minutes, but in the future, we can just advertise as 90 and that won't be a problem.
There's just so much good stuff to talk about. Just try to squeeze it all in.
I agree. Well, thank you, everyone who came and who could come today, and look for an email from me. I will have a survey, and then we'll also send you the resources Dr. Brchan has. I'll send that to you in email, and then I'll also send you a copy of this presentation, like the recording, in case you want to refer to it back for reference. So thanks for coming. And we actually have another event coming in November, November 13th, and that's with the Children's Hospital of Atlanta. And they'll be talking about ways to treat migraine without medicine. So specifically like different CBT types of approaches, and really dive into more of the mindfulness and sleep hygiene things and stuff like that. So there is some overlap, but a different set of providers will be there. And Dr. I think her name Beth Rosengrant is amazing. So feel free to sign up and come if you want some more information. And as always, if you have any questions or anything comes up for you, you can always email me and I can be a resource for you. So thank you so much. And Dr. Brchan, this was amazing. I am so glad that we did this. And we'll definitely look forward to working with you again.
Thank you so much for including me. I really appreciate being involved.
Awesome. I do too. So I'm really glad we built this friendship and relationship. So until next time, farewell, everyone, and thank you.